Number 4, it's all about alignment and how you move around. See, intra-abdominal pressure means pressure inside the abdomen and pelvis that your core muscles are designed to control. If our posture is not aligned optimally, that means how we sit, stand and move around, then our core muscles aren't positioned to do their job properly and contain that pressure. So if your core muscles are weakened, they are also not able to perform as well as we want them to. So the two parts of muscles separating from the middle, taking other core important muscles and fascia structures along with them. And this leaves the front of the abdomen unsupported and unstable. So this vertical seam of connective tissue, it's designed to be taut from breastbone to pubic bone, but it cannot perform or function optimally if your alignment is off. The result may be a stomach that protrudes due to a continued gap. There may be back pain, pelvic floor weakness, or other discomforts. So it's alignment we need to address a diastasis. And that means how you stand, how you walk and move around. Here's some adjustments you can try. Your ribs should be directly above your pelvis, not thrust out in front. So stand straight with your feet flat and feel for your bottom ribs. Place your thumbs there. Then take your pinky finger down to find the knobbly bony bits at the front of your hips. If your ribs are thrust forward, think about settling them back in and down above those hips. Second adjustment, untuck your butt. From years of conditioning or dance class or just the way we move, many women tuck their backsides underneath them, so it's kind of flat. This does your tummy and pelvic floor no favours, which we dig into much deeper in MUTU System. But for now, untuck it. Your backside should be curved, out and proud. Your glutes are your friends. Work them. And third adjustment, look down at your feet and see which way they're pointing. They should be pointing forwards, the way you're going, not out to the sides. Now, if you feel knock-kneed when you straighten them, then just try and imagine you're rolling your thigh bones and rotating them outwards. The arch of your foot will lift up a little, that's fine, keep practicing.